supportive care things. I have 6 topics. I have 15 minutes. That's 2.5 minutes per topic, so I'll be briefer with some. Olanzapine has been shown to help prevent nausea and vomiting with highly emetogenic chemotherapy a couple of years ago, almost to the month. This year at ASCO, there was another abstract that actually helped support that particular phenomenon. Looking from Thailand, looking at olanzapine in addition to ondansetron and dexamethasone for highly emetogenic chemotherapy. You'll note there was not an NK1 receptor antagonist there. It's too expensive. That's why they did this particular trial. What they saw for a complete response and for antiemetic trials, that means no vomiting and no need of rescue medications. 69% if they got olanzapine, 25% if they got placebo, a significant p-value with not that many patients. These and other data raise the question, do you still need the NK1 receptor antagonist that costs hundreds of dollars per dose now that you have olanzapine? And this is advertising I'm doing here. This study should open over the next month or so, Alliance trial. Forget this part, this is not as important here, but taking patients with highly emetogenic chemotherapy, AC or cisplatin greater than 50 milligram per meter squared per dose, and randomizing them to get the 4 regimens that we have, palonosertan, dexamethasone, olanzapine, and fosaprepitant, versus take away the fosaprepitant and put a placebo in here and see how much the fosaprepitant actually adds. That should be happening pretty soon. Next thing to go on to is cryopressure for CIPN, chemotherapy-induced peripheral neuropathy. This came from Singapore. I want to be international in my presentations, I guess. This is what is cryocompression for trying to prevent chemotherapy neuropathy. This cartoon kind of illustrates it. Kind of think of scalp cryotherapy. They have a machine which gives cold therapy to the hands and the feet where you get peripheral neuropathy. It also causes some pressure in there, so it helped to squeeze out the chemotherapy so it doesn't get there as much, because there are some suggestions that pressure with surgical gloves can actually decrease chemotherapy neuropathy. 13 patients, so a small study. Mean skin temperature decreased. It was relatively well tolerated. There's one patient who had to have the temperature raised a little bit, but nobody had to stop. Now these are comparisons from, this is the arm that you saw here looking at nerve conduction testing, and down is bad in this situation. This is the current trial. They compared it to a previous trial they did where they randomized one extremity to have cryotherapy, not the pressure, and one to have not, and they measured the same things, this amplitude here, and this was the one that was the control, and this is the cryotherapy alone, and it looks better if you do the cryocompression for there. So we did a randomized trial that was actually submitted to ASCO this year, Dr. Ruddy and myself, looking at patients getting paclitaxel, random